Welcome class, I am Megan Brown, your instructor. Today we'll be going over chapter 6 from your required textbook, and we'll be focusing on acute coronary syndrome. We'll be discussing the spectrum, pathophysiology, clinical manifestations, the assessment, diagnostic findings, medical treatment, and the nursing process. At the very end of lecture, there will be a case study giving a scenario and a questionnaire that will need to be filled out and turned in online by 11:59 tonight. You guys will be able to form groups with 5 people and discuss and answer the questions. Everyone is also going to be required to find one article related to acute coronary syndrome. This article will need to be a peer-reviewed and scholarly that has been written within the past 5 years. You will then write a 1-page summary relating to your article and comparing it to a nursing theory. This will also be required to be in APA format. Before we get started, we are going to discuss my VARC assessment results. According to the VARC assessment tool, I'm a read/write learner. I found this to be very interesting since I love to do hands-on and feel like I learn more from demonstrations. The VARC assessment tool has helped to influence this design by providing a read/writing PowerPoint. Students will be required to read/listen to this PowerPoint and then apply their learned knowledge to a case study where they will answer questions regarding a scenario. Acute coronary syndrome is an emergent situation characterized by an acute onset of myocardial ischemia that results in myocardial death. There are 3 spectrums to an acute coronary syndrome. The first is unstable angina. This has clinical manifestations of an acute coronary syndrome, such as your patient's going to present with chest pain, have shortness of breath, indigestion, but your EKG and your cardiac biomarkers show no evidence of an acute coronary syndrome. The second is a non-STEMI. This means that you have no ST elevation in your EKGs, but you will have elevated cardiac biomarkers. The STEMI is the most emergent. This has ST elevation and EKG changes in at least 2 leads. The pathophysiology behind acute coronary syndrome starts with plaque rupture and thrombus formation, which results in complete occlusion of an artery. This can lead to ischemia and necrosis of the myocardium. Other causes of acute coronary syndrome include vasospasms, which is a sudden constriction or narrowing of a coronary artery, decreased oxygen supply from blood loss or decreased blood pressure, and increased demand for oxygen are other causes of an acute coronary syndrome. The area of infarction develops over minutes to hours, and the cells are deprived of oxygen. Ischemia develops, cellular injury occurs, and lack of oxygen results in an infarction leading to the death of cells. This results in an acute coronary syndrome. Patients experiencing acute coronary syndrome often are experiencing chest pain that is unrelieved by medications such as nitroglycerin or rest. They can also experience shortness of breath, indigestion, nausea and vomiting, and anxiety. Their skin may feel cool, clammy, and patients may look pale. As a nurse, your assessment should include chest pain on a scale of 1 to 10, assessment for jugular vein distension, perform vital signs such as your blood pressure, your heart rate, your respirations, your oxygen levels. Do they seem anxious? Are they lightheaded? Are they restless? Do they have a feeling of impending doom? Are they stable? What is their rhythm on their EKG? Assess their lung sounds. Do you hear crackles, which can be a sign of pulmonary edema? Are they going into cardiogenic shock? What are the signs of cardiogenic shock? Do you remember? That's right, increased heart rate, decreased blood pressure, dysrhythmias, decreasing level of consciousness. All these things are very important in assessing for patients with acute coronary syndrome. Diagnostic findings will help to clarify whether the patient is having unstable angina, a non-STEMI, or STEMI. Patient history must be obtained in a detailed description of presenting symptoms, history of previous cardiac and other illnesses, family history, and current list of medications. must be asked. Risk factors can also be assessed, such as their age, do they have hypertension, high cholesterol, are they diabetic, do they have positive family history, what is their diet or their lifestyles. A 12-lead EKG will be extremely helpful in assisting in ruling out an MI. Your expected EKG changes include T-wave inversion, ST elevation, and presence of a Q wave. The presence of a Q wave normally means that their acute coronary syndrome has happened a few days prior. An echocardiogram can also assist in diagnosing an acute coronary syndrome, especially when an EKG is non-diagnostic. Your echocardiogram can help evaluate ventricular function, ejection fraction, and abnormal wall motion. There are 3 lab values that are important in identifying acute coronary syndrome. Troponin is a protein found in myocardial cells that regulates contraction. It is a critical marker of acute coronary syndrome. An increase in the level of troponin can be detected within a few hours and remain elevated for as long as 3 weeks. The CKMB is found in cardiac cells and increases when there has been damage. It is also an indicator of acute coronary syndrome, and levels can increase within a few hours and peaks after 24. Myoglobin is a heme protein that helps to transport oxygen and is found in cardiac muscle. It starts to increase within 1 to 3 hours and peaks at 12. Your medication management includes administering oxygen, giving a dose of aspirin, nitroglycerin paste, statins such as Lipitor, giving anticoagulations such as heparin, Plavix, and Brilinta. Morphine can also help to relieve chest pain. Most hospitals do have a protocol in place for which medication can be given, which is helpful, but as a nurse, you need to know how to treat a patient with acute coronary syndrome. You can also give thrombolytic therapies. This is initiated when a percutaneous coronary intervention is not available or your transport time to a PCI-capable hospital is too long, which is 90 minutes. The purpose of thrombolytics is to dissolve the thrombus in a coronary artery, allowing blood flow or reperfusion to start again. Minimizing the size of infarction and preserving ventricular function is extremely important. Thrombolytic therapy does not affect underlying lesions such as plaque or your calcium, and is contraindicated if your patient is bleeding or has a bleeding disorder, and thrombolytic therapy must be given within 30 minutes of symptoms. Your hospital management includes cardiac catheterization, which opens the occluded artery and restores blood flow. After this, the patient is then admitted to a cardiac intensive care unit where they can have intensive cardiac monitoring. They get started on certain medications such as beta blockers, aspirin, antiplatelets. They get education on diet and modification lifestyles, as well as smoking cessation. Cardiac rehabilitation is extremely important for patients who are then discharged from the hospital. This is a continuation of care when the patient leaves, and they are able to make follow-up appointments with their cardiac physician. They are provided education and even group support. Your nursing process for the acute coronary syndrome includes your assessment of your patient and obtaining a full history. These are important aspects of patient care because it establishes a baseline, identifies the patient needs, and helps to determine your priority of needs. Are they experiencing chest pain? Are they having difficulty breathing? Are they having palpitations, fatigue, indigestion? Your focus assessments, such as your breath sounds and your vital signs. What's their blood pressure, their heart rate? What about your diagnostic findings? What does your 12 lead say? Let's draw some labs. Let's start an IV. Your diagnosis for patients suffering from acute coronary syndrome would include risk for decreased cardiac tissue perfusion related to reduced coronary flow. Another example of a nursing diagnosis would include anxiety related to cardiac events and possible death. Deficit knowledge about post-acute coronary syndrome, self-care afterwards, and Your major goals would include relief from chest pain or ischemic changes, maintenance of tissue perfusion. So would you increase their fluids? Would you start them on some inotropic medication such as dopamine if their blood pressure is low? Let's improve their respiratory status by intubation. Let's decrease their anxiety, establish a trusting relationship with our patient. Your intervention should include the diagnostic testing that we've already talked about, such as your 12-lead EKG, giving them medications such as morphine. Let's contact your physician with the results and make sure that you are documenting everything. Outcomes for acute coronary syndrome include adequate cardiac output, relief of chest pain, and making sure the patient receives the care they need the care and treatment they need in a timely manner, as well as no adverse reactions from medications. Here's your case study. A 59-year-old Caucasian female is admitted to the emergency room with a diagnosis of chest pain. She complains of a squeezing type pain across her chest and into her left jaw area and feeling nauseated. Her symptoms started at midnight and she called EMS right away. It is now 12:30. During your initial assessment, the patient is rubbing her chest, grimacing, and is diaphoretic. The pain has been occurring intermittently since midnight. Her color is pale except her mouth, which is now starting to turn blue. Cardiac auscultation reveals a rapid, regular rhythm and a murmur. She has never had this pain before. Lung sounds are crackles in both bases. She is anxious and she states she is going to die. Her vital signs are blood pressure is 180/95, her pulse is 120, respirations are 22, and her oxygen is 90% on 2 liters of oxygen. Her temp is 99, and her pain is 8 on a scale of 10. You obtain her history, and she states she has high blood pressure, she's a current smoker, and her mother has suffered from a heart attack. I want everyone to get in groups of 5, and I will pass out your question sheet. I want you to please write down 3 nursing interventions with rationales along with 3 nursing diagnoses, including your goals, expected outcomes, and potential complications. Remember to submit this assignment along with your 1-page article summary compared to a nursing theory by 11:59 tonight. I will be available if there are any questions, and please feel free to email me. Thank you.